Good afternoon. I really appreciate being here, and I appreciate Lucas's comments about where the presentations are going, because I feel like Matthew really elevated the conversation. I'm about to pull it right back down in the weeds again. So I'm going to talk a little bit about, just in a broad and general sense, how animal health issues impact trade, and then talk specifically about a few events that we've had, and there will obviously be opportunities for us to talk more about trade and animal health events as a whole. And when I'm speaking of trade, I'm talking about trade in live animals and animal products. And animal products includes everything from the meat products to the byproducts and the pet food ingredients and all the other things that end up coming from as a result of animal production. And most of the time today I'll spend talking about how we manage animal health disease events and then how that has an impact on trade. So we'll start with a few diseases that we're all really familiar with and probably pretty familiar with the impacts that they have on trade. Any of the diseases on this list are considered high consequence, and when they are identified in a country, exports of live animals and animal products would pretty much immediately be restricted. They do have significant impacts each and every time they're identified, and most everybody here, it was just mentioned the high-path avian influenza outbreak in 2015, and I think we're all aware of the significant trade impacts that resulted from that disease outbreak. The other piece that goes along with that is that the United States regulates imports for these same diseases and other diseases. So we have teams that monitor for these disease outbreaks around the world and look for whether we need to change the disease status for a region or change an import requirement based on these kinds of animal health events. In addition, there are other diseases that you might not think as much about that can also have significant impacts on trade. Blue tongue and bovine leukosis are really important for the cattle trade for the United States. These are diseases that we have. And because we have these diseases, there are requirements for export from the United States that we would not otherwise have. For instance, cattle cannot go to certain countries from certain parts of the United States because of our blue tongue status in those areas. And then we have testing requirements in some cases for both of those diseases. Low-path AI, as you're aware, also has impacts on trade. Usually low-path AI doesn't have the same immediate restrictions that high-path AI does. Some countries do have immediate restrictions in association with low-path AI, but because we have methods of control to control low-path AI so that we can prevent mutations to high-path AI, some of our trading partners do prevent importation from products from areas where we've identified low-path AI, and so that has an impact on us as well. But we try to plan our control methods to mediate those impacts as much as possible. So to go through a couple of the more recent scenarios, I think most folks will remember the Newcastle disease outbreak in the early 2000s. It was a complex outbreak that involved both commercial and backyard poultry. Matthew mentioned some numbers of birds from the HPAI incident last year. This incident included more than 3 million birds, and the overall loss to industry was estimated to be about $5 billion. That included export losses from the restrictions imposed as a result of the disease. And that took us, I think it was about 18 months in total from the beginning of that outbreak until we were able to say we had concluded our work with that outbreak. A lot of people will also remember the first case of BSE identified in the United States. That was in December 2003. There were significant immediate restrictions associated with that case of BSE. In 2003, the U.S. exported greater than 1 million metric tons of beef and beef products, and in 2004, after that case was identified, our exports were approximately 200,000 metric tons of beef and beef products. And just this last year, one of the top 10 priorities for the APHIS administrator was to regain market access to markets that we had lost during that time and that we still had not regained access to. So we've made a lot of progress in the intervening years in regaining market access, but we still have not regained all the markets that we lost due to that case of BSE. And then much more recently, high-path avian influenza. The numbers that I have here are the 2014-15 outbreak. The cases that we've had most recently, I do not have the numbers for yet, but in that 2014-15 outbreak, a total of 232 premises, which include, again, commercial and backyard premises. And as Matthew mentioned, approximately 50 million birds lost as a result of the presence of the HPAI strains. The response activities cost us over $800 million for depopulation, indemnity, cleaning, and disinfection, and the economy-wide impact was estimated at $3.3 billion as of July 2015. During that time and since that time, we have continued to work diligently with our trading partners to try to minimize the trade impacts. We are looking for agreements and have worked on agreements to accept trade from areas of the country that are unaffected. And regionalization and zoning is what we call that. Been really successful with a lot of countries, and I think in these recent cases we've seen the results of some of that success. We've had fewer countries to establish countrywide bans, more of our trading partners to go with state or county level bans. We are still working. We'd love to have our trading partners go for bans that are just our control zone, and for them to accept our control zone as the control zone that's important to them. Again, we're still working on those. Spend just a minute on some other emerging and novel diseases and trade impact, because that can be a little more challenging and interesting with the sort of the known diseases and the known impacts. So for high-path avian influenza, as soon as we hear the first case has been identified, we know what to expect from our trading partners, and we have a plan for how to address what we expect from our trading partners. But with novel and emerging diseases, that's often not the case. So we have two different examples here. In 2013, porcine epidemic diarrhea was identified in the United States. This disease had significant production impact. However, we did not have the trade impact one might expect given the production impact. Very few of our trading partners put in any new requirements for the export of live pigs. A few did testing or certification requirements, but essentially nobody restricted the export of pork from the United States strictly because of PED. On the other hand, in 2009, we had an influenza virus, an H1N1 virus, and because the H1N1 virus had been known to be associated with swine in the past, the disease was called swine flu from the beginning. And so even after we quickly determined that the human cases had not had contact with pigs and that the virus was circulating in humans and not in pigs, there were trade impacts regardless to our pork exports. So the fact that it was initially called swine flu, even though we really did not have an animal health event at all, caused some really significant markets at the time, including China and Russia, to impose restrictions on the pork exports from the United States. And we were able to resolve those restrictions with time and communication with those trading partners, but those were trade impacts that you wouldn't have necessarily expected since we weren't actually having an animal disease event. Before I talk about the trade mitigations, I want to mention one other thing that was mentioned in the sessions this morning. It was mentioned about the work that we do with the World Organization for Animal Health and the other intergovernmental organizations. I think the work that we do in those organizations is really critical. The U.S. is one of 180 member countries in the OIE, the World Organization for Animal Health, and we really work closely with them on standards and systems that improve the transparency of animal health worldwide and give us a stronger footing when we are working in trade arenas. So one of the things that we really support in OIE is the disease reporting mechanism, which requires member countries to report certain significant disease events within 24 hours, and then has other reporting requirements for less significant disease events. Supporting those requirements for transparency really helps us in our trade environment. It establishes the level of comfort from trading partners to understand that they will know what's going on with trading partners who are members of the OIE, and then that way they can be comfortable with what we are talking to them about when we're asking for lesser restrictions in certain areas. Another piece of work that we're involved with in the OIE that's really important is establishing the animal health standards that are in the Terrestrial Animal Health Code. Those standards are recognized by the World Trade Organization as the standards that we should follow in trade, as the minimal standards that countries should expect in their trade with their trading partners. So we feel like the successful work that we do in OIE is really, really valuable to helping us build the relationships with trading partners and have a level playing field in trade overall. And I think the ambassador this morning mentioned how important that work is, and I just want to mention it as well because we are currently looking at chapters to review for the next OIE general session in May. We encourage industry to be involved in that as well and to help us build the standards that work for both the U.S. and for our trade internationally. So moving then to how our trade, how our mitigations impact trade. Some of the things that we do to try to help mitigate the trade impacts when we do have an animal health event are trying to have a timely and effective response. We've put a lot of effort into our emergency planning and response activities so that we can have a timely and effective response to control and eradicate disease, and so we can communicate that response clearly to our trading partners so that they are comfortable with the work that we're doing and they're comfortable that they can trust the outcomes that we say that we have with regard to control of disease. Another step that we've taken is to work really hard on the zoning and regionalization that I mentioned before. We try to encourage our trading partners to limit their trade restrictions to the geographic area where a disease has occurred and not have impacts across the whole United States. We've had success in this area in the last couple of years. Some of our trading partners, including Japan and Canada, have agreed to regionalize and use smaller areas of the United States in their restrictions. That has not been the case for all of our trading partners. We continue to work on that concept, and later this afternoon you will hear more about compartmentalization, which is not based on the geography but is based on the biosecurity standards, and we're really starting to work in that area as well and starting to socialize the idea that that's another way that we might be able to limit the restrictions that we see. We work diligently on agreements with trading partners up front so that we have plans in place before a disease outbreak happens, and we continue to work through the outbreak and into the next one. And that's the example with the high-path avian influenza from 2014 and 15 and today. We started working during that outbreak and immediately following that outbreak to really booster our agreements and to look at regionalization more closely with a lot of trading partners. A lot of energy and effort went into developing regionalization protocols with a lot of trading partners, and I do believe we have seen benefits from some of those conversations in the most recent cases. Again, not every trading partner has reached agreement with us on those regionalization, and in some cases the zones are a whole state rather than a county or the control area, which would be our ideal. But I do believe we've made a lot of progress in the area, and if we continue to work with our trading partners and demonstrate our ability to be transparent with them, then I think that will continue to improve in that area. And that's the last piece of this. You know, modeling what we expect of our trading partners in our import actions is really important as well. When we go to our trading partners and ask them to regionalize us and only restrict a control area when there's a disease outbreak, we have to expect them to ask the same thing of us in return, and we have to be prepared to either grant them that or explain very clearly with a scientific basis why we can't do that. So we work really hard in our negotiations as well to make it clear that, you know, the actions that we take are the actions that we expect our trading partners to model. So we'll talk just a little bit about how our response activities affect trade. And when we choose our methods for depopulation, disposal, and C&D, the methods that we choose need to demonstrate that we are effectively controlling the disease outbreak in a timely and effective manner again. And it has to be methods that our trading partners can understand and can depend on. And so, you know, we make good faith efforts in every event to make sure that we do use appropriate methods that will allow us to explain it clearly to the trading partners, and then will allow them to release restrictions as quickly as possible. In a lot of cases, we've had to talk with them and explain exactly what we're doing, but usually we are able to clearly explain and they understand and again, are willing to release restrictions as soon as we say a facility is now ready is clean and there's no more evidence of disease there. It's really important how we establish our movement controls as well. One, so that we can demonstrate to our trading partners that risky movements are not happening and that we have established a control zone that is effective, and so that they can have confidence that nothing is moving outside of our control zone, that we have concerns about the risk level, and obviously nothing then is moving into export. It's also very important, again, that we follow our own guidance with those control zones, and that if a product is really not risky, that we allow it to continue moving, and we explain that clearly, because if we choose to restrict a product that's really low risk, then we should expect our trading partners to put those same restrictions in place, even though the risk is not there to support that. We work really hard to have good epidemiological information so that we can define the outbreak clearly. That helps to identify any potential risks for the future that we can affect in the future, and it also helps us to describe again to our trading partners that we understand the situation clearly, we know exactly what we're doing, what we're working toward, and we have everything under control. The final piece on this slide is vaccination. Vaccination can be a really useful tool in the event of an outbreak, but it's one that we have to consider carefully when we decide to use it or not. There's certainly a perception that when you choose to use a vaccine that it means your control efforts aren't effective, and there's also a concern that if you use a vaccine it might mask disease. So when we choose to use vaccination, we will have to choose that very carefully with those considerations in mind and the potential impacts on trade from using the vaccine. We want to balance that against domestic production impacts of potentially not vaccinating. So it'll just be a really important discussion to have and to consider the full case when we make that decision. This is the last piece to talk about in disease response activities. I mentioned earlier that everybody's listening and we do our official reports through the OIE. It's really important to try to keep the message clear and succinct. Trading partners really do not like to hear news about a disease outbreak from the media first. They really want to hear it either directly from us first or at least through the official international channels. And when you have to report a high consequence disease within 24 hours to the OIE, it's really it is really a problem if the media starts to report ahead of that. And so it's really important in all the cases, especially for those high consequence cases, that we are on message and that we have our media reports together. But even in the lower consequence cases, it can be really important because a misstatement in the media can turn into something that you weren't expecting. Think back to the swine influenza example earlier. So it's really important, and we try hard to coordinate with all the stakeholders, including the state representatives and industry, in the event of any animal disease outbreak, to coordinate our media messages and release the same message at the same time. And the reason for that really is to just make sure that the message that we want everybody to hear is the message that they hear, and they hear it from us first. And I think that's the most important thing for our trading partners. It's just like any other thing. The rumor mill can get really excited really fast if they hear bits and pieces of things that they're not sure about from sources that they can't confirm or aren't comfortable confirming.